5 on your health tonight. The debate over vaccines just raging on. Nearly 24 medical societies now asking the nation's health secretary to resign. Joining us, Dr. Scott Hadland, Chief of Adolescent Medicine at Mass General Brigham for Children. Great to see you, Dr. Hadland.
Good to see you too.
Thanks for coming in, Dr. Hadland. So the big question that's out there right now, do people, like frankly the three of us who are middle-aged, relatively healthy, we've had, probably 5-ish COVID shots by now, do we need another COVID shot?
Yeah, the major medical organizations representing hundreds of thousands of doctors across the country are still recommending the COVID shot. And here's why. Yes, we are generally healthy people and so aren't at as much risk of getting severe COVID, but the COVID vaccine's been associated with fewer hospitalizations, fewer severe illness episodes, fewer times that people end up in the ICU, and fewer episodes of long COVID. And so, you might make the determination for yourself that I actually want to avoid those things, and so you might choose to get the COVID vaccine because of that. I think the second thing that people need to consider is that often there are other people at home, right? Young babies or older people or people who are immunocompromised, may have cancer, who are going to be at greater risk if they get cancer, and so, if they get COVID. So you want to make sure that they're protected by your vaccine.
And that would include, for you have kids, you just told us they're 7 and 4, that would include your kids as well for the COVID shot?
That's right, my kids are fully vaccinated and I myself am fully vaccinated, yeah.
Yeah, so talking about the kids, we have some questions from the viewers. Of course, with mixed messages coming from the federal government and these other agencies, people do have questions. So the first one comes from Shannon, and she asks, why do babies get so many shots?
Yeah, it can feel like a lot of shots, right? So there are 18 different diseases that we immunize against in babies and kids in order to protect them. And I think what's really challenging about this is that many people don't know about these 18 diseases because we've cut back on them by vaccinating, right? So an example is, there's the Hib vaccine, Haemophilus influenza type B vaccine. Have you ever heard of anybody getting Hib infections? No, but that's because we vaccinate against it. Well, before I ever became a pediatrician, that immunization, that vaccine hit the market and made it so that kids never got this severe infection that results in meningitis, can result in death, results in severe breathing problems in kids. I've never even seen it as a pediatrician, right? So it just becomes hard to prove the absence of diseases that we're not seeing because we vaccinate. But this is why we vaccinate, so we don't see them.
Well, one other disease that everybody should remember is chickenpox, right? There was not a chickenpox vaccine when we were kids. I would assume I had it, you had it.
Yep.
And so we all got it. Now our kids don't have to go through that because there's a vaccine they get as
That's
infants.
right.
Yeah.
All right, here's another question. This one's from Angela. She writes this: our daughter refuses to vaccinate our grandson. How can we get her to change her mind?
Yeah, this is a tricky one, and this comes up all the time for me as a pediatrician, right? So look, most people across the United States actually support vaccination. 8 out of 10 adults want vaccination, want kids to be vaccinated, want kids to be vaccinated before they go to school. So most people really support vaccination. I got to be clear about that. But there are some people who have questions, and I always start from a place as a pediatrician of, look, you just want to do what's best for your child, right? So everybody who has questions is just looking to do what's best for their child. So I start with that. I think the other thing is we have to help people get accurate information. There's a lot of misinformation and disinformation out there. And I'll just sort of highlight that as somebody who loves his kids and as somebody who's had a chance to, see the studies and get read in on all this stuff, I've made the decision to vaccinate my own children because starting from that place of I want what's best for my kids, combined with I've got the right information, it helped me to make the decision for myself.
All right, Dr. Scott Hadland, as always, thanks for being here.
Thanks for coming in. Good to see you.
To the web